Okay, let's talk about a little bit about the anatomy of the heart and how blood flows through the heart. The vena cava bring oxygen-poor blood that has already passed all through the body into the heart. So we have the inferior vena cava and the superior vena cava. The superior vena cava is feeding blood that comes from the upper part of the body, like the upper extremities. The inferior vena cava is feeding blood that comes from the lower part of your body, like your extremities and your belly. So this superior and inferior vena cava bring the blood into the first chamber of the heart. And the first chamber of the heart is the right atrium. The heart has 4 chambers. We have the right atrium, the left atrium, the right ventricle, and the left ventricle. So blood comes from the vena cava into the right atrium of the heart. On contraction, that blood is pushed through a valve into the right ventricle. This valve that it comes through, it's a one-way valve, is called the tricuspid valve. This keeps the blood flowing in the right order. So that valve opens up, the blood comes through, and it closes. Once it's in the right ventricle, it will move through the pulmonary valve and then out into the lungs. Once it gets in, and it will lose carbon dioxide. That oxygenated blood comes back to the heart, and it comes back through the pulmonary vein and enters into the left atrium. The next contraction, it's going to push it through this valve. This is called the mitral valve, into the left ventricle. Now, if you'll notice, the left ventricle, the walls of that part of the heart are much thicker, and that's because there has to be a lot of force to force that blood out of the aortic valve, up through the aorta, and out into the body. So the heart has 4 chambers and 4 valves. The first chamber is your right atrium, your right ventricle, your left atrium, your left ventricle. You have 4 valves: your tricuspid valve, your pulmonary valve, your mitral valve, and your aortic valve.